Hi everyone, and welcome to ATP Live Monday. How has your day been? Um, oh well, I had a lovely Monday. So welcome to ATP Live. This program is brought to you by Ask the Paediatrician. You get to ask any question that you may have about the health of your children and get immediate answers live from a pediatrician. So welcome, whether you're watching on Instagram, on Facebook. Good evening, Sonia. Thank you for joining us on Instagram. Facebook people, you're welcome as well. Just try and let me know you're there. The first thing I'm going to do is to share the video. Let's share the video so that everybody can see, everybody can hear. I'm just going to do the same thing as well. Just give me a minute so that we can just share the video. After that, we can now okay, I'm seeing myself okay, I don't see the live video. Okay, but I'll try and just share the video. Okay. Just try and I'm also just sharing to all our platforms. So um, then we can start. If you have any questions about the health of your children, just post the question directly as a comment under the video, and I'll be able to see it and I'll be able to answer your questions. Um, okay, I'm also just going to look for the video itself. Unfortunately, it's not showing on our page. Um, okay, I have something now. Okay. All right. I think I'm done with all the sharing. I just need to pin it. Okay, certain difficulties. Sometimes Facebook just misbehave sometimes. Okay. Just doing all the sharing first, and then after that, I can start to answer the questions. Okay, let me just do the pinning now in the groups. So, okay, I think I've been able to pin it down. All right, so and then pin in the groups. So many things to always do. So that otherwise some people will say, oh, we didn't see the video. So good evening everyone. Welcome and happy Mother's Day to the Americans, the mothers from Americas and Canadian that celebrated their own Mother's Day yesterday. So it's not yet too late to wish you happy Mother's Day. Hope you had a lovely, lovely time being celebrated. Every day is Mother's Day anyway. Mothers need to be celebrated every day. All right. So we celebrate our mothers. We thank you for all you do. Of course, I'm sure the UK and other places have celebrated theirs in March. So, okay. I'm just still trying to pin the post and then I'll be right with us. Just another couple of minutes. Okay, I can't find the post in ATP family. Okay, yeah, I'm sending now. All right. I don't seem to find it again. All right, so welcome everyone to ATP Live Monday. This program is brought to you by Atp Pediatrician's Foundation. Atp Pediatrician's Foundation is committed to the health and to the welfare of all children globally, and especially in Nigeria, Sub-Saharan Africa, where a lot of our children still die from preventable causes. So we do a lot of health education, health information. We do a lot of community medical outreaches, and May is usually our Children's Day outreach. So a lot of our states and zones are preparing for the Children's Days outreach. So we look forward to going to communities to be a blessing to the children there. So ATP Live Monday is just one of our programs where you get to ask any questions that you may have about the health of your children, and we try to answer them in the next 1 hour. But remember that even after the live session, you still have opportunity to ask your questions on our Facebook group. For children health questions, you can post to Ask the Pediatricians, the main Facebook group. Whereas for other health issues, you can post to ATP Family. Okay, try and post your questions and be patient. For children that are sick, please try and go to the hospitals because we will not be able to do urgent questions and answer. But for things that are not urgent and they're just education based, we are happy to answer them within our time. So thank you so much for joining me, whichever platform you're watching from. So if you have any questions, feel free to drop your questions. Start with the age of the child. As we are aware, pediatricians, we manage children from age 0 to 18 years. So the age of the child is quite important for us to know the right concerns and how to situate it to give a context. Okay, try and keep the question short. If you are watching in any of the Facebook groups, whether on Super Parents or Ask the Pediatrician Facebook group, please click on the video. If you don't click the video, I won't see your comments. Okay, if you just put your comments directly in your group, I will not see it. But if you want to ask a question, click on the video so that you can drop your questions as comment directly under the videos. Those on Instagram, YouTube, that doesn't apply to you. You can just drop your comments and I will say. But if you are watching on any of the groups, if you are just watching to learn and you don't have any questions, that is fine. But if you are watching to ask specific questions, please click the video so that you can drop your questions directly as a comment under the video itself, and then I'll be able to answer your questions. Otherwise, the question will be in the group, but I will not see it here on my on my hand. So you're welcome. You're welcome. Feel free to drop your questions and I will try and answer them. And so just to also let us know that apart from the Facebook groups where you can ask your questions, we have our podcast platform, Hacks.org podcast, where you can listen to past teachings and videos as well. Or you can also watch those videos on our YouTube, ATP TV with double E on our YouTube channel, and then you can also read the articles on our website at www.askthepediatricians.com. So there are so many platforms that we have, and you can also follow us on social media, on Instagram, on TikTok. You know, I'm not being consistent in posting that on Twitter, on all the social media handles. Try follow us so that you can learn about all these health issues that affect our children. So you're all welcome. Okay, I think I got my first question on Facebook from Shogunuga Emilia. Okay. All right. You say your baby is 11 months old, born at 36 weeks, weight is 2.5. So your baby is a near term baby, you know. But the birth weight is actually normal birth weight, and baby is 8 kilos, okay, and all effort to make her hard weight is futile, okay, but the doctor keeps saying she's LD and she can't find anything wrong. What do you advise I do? Okay, so thank you so much for that question. Yes, your baby is 11 months old. An average 11 months old should be weighing between 9 and 10 kilos. So, even though your baby is weighing 8 kilos, it is not too far from the normal, okay? But then definitely we expect your baby's weight to be closer to 10 rather than 8. So, but anything between 80 to 100, 120% of the average is still within normal. So I understand what your doctor is saying, that the weight is fine, baby is healthy, but your baby is actually on the lowest limit of the normal. So, you know, everything is a range. So there's what we call average, and then some people will be a little bit below the average and still within normal, and some people will be a little bit above the average but also still within normal as well. So the lowest limit of normal for your baby would be that 8 kilos, and the highest limit will be about 12 kilos. But we usually want the baby to be, you know, not too close to that lower limit, because that means that baby is already at risk, because the baby doesn't have so much reserve. So any health issues, any little issues, that baby can just tip over and go down to becoming underweight and all that, which we don't want. So I'm definitely not going to be comfortable saying your baby should remain at 8 kilos. I would rather the baby moves closer to 9 or 10 kilos, which will now become the average. So what can you do? So I would first want to know how you're feeding the baby. Of course, there are many issues that can affect baby's weight, but we start with the food. Are you still breastfeeding the baby? How many times are you feeding the baby? Are you giving variety of food and making sure you're giving things like protein and variety, not just only cereals and milk, which is what a lot of us mothers do. So you need to make sure you are feeding your baby appropriately. So a lot of mothers will say, "Oh, my baby is eating well," but that eating well just means that baby is obviously is having something going into the tummy. But for us as pediatricians, what is well? We want to know what actually goes into that baby's plate. What's the quantity of the carbohydrate, what's the quantity of the protein, what's the quantity of the fat, are you giving the fruit, the veggies, the baby getting dairies? So we want to make sure you are actually doing the right thing, and not only that you are doing the variety, but you're also giving different food. So it's not all the time pap or a particular cereal from the shop that we buy and give baby 24/7. We need to make sure you're feeding the baby appropriately. So we have a lot of resources on that. You can check our website, you can check our Facebook group, and go to the guide section on complementary feeding. Just go through all those principles. For check that your baby is eating well. So if your baby is actually eating variety of food, eating adequate quantity of food, and despite that the child is still not adding weight, then we want to know is there any medical issue? Is there any underlying health issue? Because sometimes some babies have some underlying health issues, and that may be the reason why that baby's weight. So I'm expecting those are the kind of things I expect that your pediatrician would have that conversation with you. We also want to make sure your baby is not having low iron, because sometimes mother focus on the big, what we call the macronutrients, the big nutrients, your big food, but there are also some what we call micronutrients, some tiny minerals and vitamins that your baby do not need in big quantity. But if your baby also is deficient in them, it will affect the baby's metabolism and it can affect their weight gain as well. So there are lots of issues to unpack. Unfortunately, we're not able to do that enough. This will require like a full consultation to ask that. Okay, so for example, if you come to my clinic, I want you to do what we call a 24-hour meal record. What have you already eaten in the last 24 hours? And that will give me that information. So you said your baby is eating 3 to 4 daily, 3 to 4, I guess you want to say 4 times daily. All sorts of puree. She eats pandoyam and eba. She takes cereal and fruits. Okay, all you've listed now, for example, will be is an example of a child who is not eating well, because you've only listed all carbohydrates. Okay, I didn't see any form of protein in all your list. So is your baby eating fish? Is your baby eating meat? Is your baby eating beans? Is your baby eating things like egusi and all that, granules? All the, so you've listed so many things, and there I can't see any protein there, so that will worry me. Okay, so it's not enough for your baby to eat all this carbohydrate. Your baby needs to eat protein. Protein is actually the body building food, whereas the carbohydrate tends to give them the energy. All right, so make sure you are adding other things. So I'm happy you'll be eating the fruits, but you listed quite a lot of carbohydrate-based meals. I've not seen a lot of the protein-based meals. So you really need to look into that. So you can make moi moi, you can make a kara, you can give your child one boiled egg every day. So those are sorts of protein. And of course, baby should still be breastfeeding, I hope. So yeah, your baby is still on breast milk and you're also giving milk. Yeah, so that is also good. So those are all the other things you need. So just add a little bit more of the protein, okay? It doesn't have to be only the big carbohydrates all the time, so that the baby will do that as well. Okay, so you make your purees with chicken and fish. Okay, that's good. Yeah, but do a little bit more of the beans, do a little bit more of the egg and all that. Just variety. So if you're doing the appropriate kind of food and your child is still not gaining weight, then your pediatrician needs to look into whether there are physical health issues. Are there physical health issues that will make your baby not to thrive? So you can go back to see the pediatrician and they can have that conversation with you. All right. Okay, we have a question. So I will go to Instagram so that the question on Instagram does not disappear. Um, so the question on Instagram from Obi Haddo is saying, my 4-month-old baby is having catarrh and cough, which he got from his brother. He was placed on medication because his test shows it was bacterial infection. Okay, so I'm confused now. Who was placed on medication? Is that the brother? Okay, because you are talking about two different children now. And then do I need to take him to the hospital? So I guess the brother was the one that has the respiratory infection and was placed on antibiotics. So you are asking whether you can take the baby, the 4-month-old, okay, to the hospital. The answer is yes. I know a lot of people always think, oh, since it's the same cough and catarrh and it is you got it from the brother, I mean, we should just copy and paste the treatment. Please don't copy and paste treatment in children. Children have sometimes things may look alike but may not necessarily be the same thing. Okay, things may look alike but may not be the same, and we don't. Yes, I understood the brother was the one placed on medication, so but we don't want you to copy and paste. They may not actually be the same thing, even though both may look like it's the same infection. And also we don't want you to do self-medication, actually when it comes to antibiotics, we want it to be prescribed. So I will want you to take the child to the hospital and see your doctor, and then they can write a prescription for the brother as well. If they think the brother has the same infection, but I'm not quite sure. It may not necessarily be the same. That could just be an assumption, or the brothers may be a viral infection or something different. So, but I'm happy that you asked and you didn't just start the child on antibiotics like that. So just take them to the hospital. Mothers, let's not try and copy and paste. And sometimes, and even sometimes for the same child, parents will say, "Oh, this child, the last time the child had this fever and these symptoms, this is what the doctor prescribed." And because that's what the doctor prescribed, now the child is having the same symptoms. I'm just going to go ahead and give the same drugs. And because that's exactly, I mean, there's no point going to pay the doctor. I'll just go and buy the drugs. Number one, it's just because our country is also a little bit lawless when it comes to pharmacy and all that. In other places, you will never even be able to buy those drugs when you don't have a prescription for the second child. You won't be able to do that. And of course, you can't take out of the other babies though, because it won't be enough for the two of them. So, but in Nigeria, people I know can just walk into pharmacy and buy drugs without a doctor's prescription. And that is why we seem to get away with that, which it's not good for us, because that is what is creating all this what we call antibiotic resistance. So before you give drug to any child, especially antibiotics, I'm talking of a prescription medication, not over the counter like your paracetamol or RS. No, I'm talking of prescription based medication. Antibiotics is always prescription based. A doctor needs to write it. Okay, and also for the same child, the fact that that child took that medication 2 months ago, 3 months ago, does not mean that this time around it's going to be the same thing. Children grow, their weight increase. So, and even if the child has exactly the same symptoms, let's even assume it's the same diagnosis, and the doctor still wants to use the same drug, even the dose may have changed. Okay, and that is even making a lot of assumptions. So let's not copy and paste treatment for our children, even for the same child. The fact that the child has cough last month and was given a particular drug does not mean when the child has cough this month, we should still give that same medication. There are lots of things that could be different. So the best thing is for us to always see our doctors in the hospital and follow their advice. So Obi, you can take your baby to the hospital for proper evaluation by a doctor. All right, so let's go back to Facebook. Okay, I have another question. I think is a okay. No, okay. So Atsa Chineye. Chineye said, "Good morning, Doc." Okay, I don't know where you're watching us from, but those of us in Nigeria were in the evening, but I guess you're watching from another part of the world. But you're welcome. Thank you for all you do. Please, I have a baby of 22 months. Birth weight is 8 pounds. Okay, so I guess maybe you're in UK or US. Those are people that use pounds. Anyway, current weight is 12 kilos. Okay, you're missing them up now. Anyway, my baby is not talking yet, but here's everything you say. She even goes for every message you send her. Okay, she passed her hearing test. Okay, all right. She points at things she wants or drag you to help her get it. Okay, she makes some animal sounds. Okay, I'm not sure what that is. Should we be bothered of anything? Definitely, I'm going to be worried if it's almost 2 year old. Your baby's weight is fine, by the way. A 2 year old should weigh 12 kilos. Your baby is 22 months, so almost 2 years, and it's already weighing 12 kilos. So the weight is on point. But definitely, I'm not happy that a 2 year old is not talking. I'm glad that the child is hearing, because you seem the child can follow instructions. So the child's understanding is good, which is also good. But we would still like to confirm it by doing a proper hearing test. But definitely a 2 year old, almost 2 year old, should be talking, should be saying at least combining two words. So are you saying this child is not saying not even mama, dada, or calling things by name? So I will worry about that. And your child dragging you by the hands and also making some sounds that you're not clear about will worry me as well. So number one, I want you to see a speech therapist because a 2-year-old should be talking. They should be combining even two words together. So this is already evidence of speech delay. So we are just not sure whether it's just only speech delay or the child also have speech delay as part of things like autism and the rest of them. So we also need to do an autism screen. So if you go online and just type in MCHAT, MCHAT, and screening, you will, or you go to autism, what's the name of this other Autism Speaks? Yeah, Autism Speaks website. If you also go for screening there, they will take you to their own link where they have the M charts. They are very simple questions you can answer online, and then it will give you a score. It will tell you whether the child has a low score, a moderate score, or a high score. So if it's a moderate score, it will tell you to repeat the screening. But if it's a high score, it will tell you you need to see a pediatrician for full developmental assessment. So this child needs to do a screening. We always screen all children for autism if they are not talking. Ideally, we should screen all children, whether they are talking or not, by 16 months to 30 months. But definitely a child who is also not talking will definitely need to be screened even more urgently. So that will help us to know whether there's some features of autism that child will need to see a developmental pediatrician. But if the screening for autism is low and the problem is just the speech and the child's other aspect of development are fine, then the child may just need to see a speech therapist. Either way, see a speech therapist first, because if the speech therapist worry about other things, the speech therapist can always refer the child to see the pediatrician. So I definitely worry that your 2-year-old is not talking. There are also some resources on our website on how you can promote your child's language development. You want to play with the child, give the child choices. There are many tips for parents on promoting their children's language development. So you may also want to check that out. But this child definitely needs to see a speech therapist, at least minimum. Okay. All right. Okay. Yeah. You've put in more information. Okay. Okay. So you've seen the pediatrician. Yeah. You said you should see us. Okay. So good. Which you did. Okay. Okay. The speech therapist did some physical evaluation on her, which you passed. Okay. So what did the speech therapist advise? The speech therapist comes twice a week to teach us some things at home. So you're having speech therapy already. So that's okay. So have the conversation with the speech therapy, and the speech therapist needs to explain to you what they think is going on. Is the child just having isolated speech delay, and are they going to just do some speech therapy, and how the child will improve? So you should have that conversation since you're already seeing a speech therapist. Then you should have more information, and they should be able to explain to you what is going on and what they're doing for the child. So that is just that. Okay. But I'm happy that you've seen speech therapists. I'm happy that you started the speech therapy already, and yeah, that's good. But do that screening that I recommend as well. Do the screening. That is also important. All right. Let's just continue. Shagoniga said the doctor said she's more of a tall baby than fat. Tall does not mean the child should not have age appropriate weight. So it's not as simple as that. Okay. All right. Anu Halagun. So yeah, so good evening. My baby is 7 months, and for the past week he has been passing FEMS 2. Okay, what is FEMS 2? And because of that, I stopped giving some solid to just papa milk. No, that's not appropriate. So you don't change a child's diet because of this tool. You just need to make sure you are doing the right thing first. And I'm not quite sure I still understand what you mean by solid stool. So I do have a stool chart. So let me see whether I can post that. So I used to say what type of stool is your baby having. Where's my stool chart? I hope I've not deleted it. Yeah, okay, I have it here. So this is the stool charts. Okay, let me remove your comment so you can see the charts very well. So you can see we have type 1 stool, type 2, type 3, type 4. So type 4 is the stool that we want from, that's a normal stool. So that should be like a sausage or like snake, just long and smooth. So it's so babies, before they start complementary feeding, they tend to pass what we call semi-formed stool, almost like type 5 or type 6. But when they have started taking solid, they will pass formed stool. It won't be breaking into pieces with water. It will be normal stew, but it won't be hard. It won't be like comb, like type 3 or type 2, which is showing some uh um like corn comb or things like that. So, or it won't be like droplets like type 1 stool. So, and the child won't be struggling to pass it. So type 1 to type 3 will make us worry about constipation, and you see the children struggling to pass out the stool. But type 4 is a normal stool. It's still solid, but it's normal. Okay, so that is the type that we want. So if your baby is passing the type 4 stool, that is normal. So which is why I really want you to let me know which one the child is passing. And then what you need to do is not to stop giving the child. You should give your 4 months old, 7 months old different food. The baby should not just be on pap and milk. Actually, that is actually not appropriate. So the child, but what you need to add is to add the fruits, add veggies to the things you're giving your child, and make sure the child drinks water as well, and make sure you are still breastfeeding the baby. Okay, so that is appropriate. You said the baby sweats on his leg, knee to ankle. I'm not quite sure I understand what that means. So if your baby is sweating, make sure the room is well ventilated. Make sure the child is not over wrapped, over dressed. So you dress your baby according to the weather. If the baby is sweating, reduce the amount of clothes or layers you put on the baby. Open your windows, let there be air ventilation, let there be fan, let there be AC. It's okay to use all those with children. So if your child is sweating when everybody is actually cold, like everybody is cold and shivering, and the child is very hot and sweaty, that is when we will worry about that. But I'm not really quite sure I understand the part of sweating on his legs from knee to the ankle. Is with the clothes on or with his clothes off? I don't know. Like that would be more relevant. So for if your baby is sweating like that, just take off the shorts or trouser. Let the baby just be in the nappies, and make sure your room is not too hot or over. Make sure the room is well ventilated. So that's what I would just say about that. But with the stool, because you didn't give me that clarity. So if you are still listening and you're watching, just let me know what type of stool your baby passed. I hope you saw the stool chart. Then I'll be able to tell you whether your baby is having constipation or not. But more importantly, make sure you're giving water. Make sure you are giving fruits. Make sure you are giving veggies, Make sure you are giving variety, not just pap and milk. That is a recipe for malnutrition. Your child should have variety of food. Okay, that's what I mean. Okay, Chinaya, you are in US. Okay, I already suspected as much because we are in the morning and the rest of us are in the evening. And okay, your baby is already saying Paul, Dada, Mama. So that I know mothers, when you say things at times, we say, I call it mom speaks. So you say your child is not talking at all. That for a pediatrician, we will take everything you say as face value. So you should have said your child has 3 single words. That is different from a child who is not talking at all, who has no words, because you said your child was making sounds, but you forgot to tell me that your baby can also say Papa, Mama, and all that. It's very important. I understand why mother, that's how mom talk, because the child is not speaking the way you expected. So that is just a literal translation you are telling me. But for us as doctors, everything counts. So if the child can say one word, that counts, because it's different from a child who is not saying anything at all. So it's so important for us to have the true picture. And I'm just saying that also as the general principle for parents. I know the way we talk to each other as parents, we kind of use some way of saying certain things, and that is mom speaks. But when you're speaking to health professionals, you need to be specific and give the real facts. So if your child is not saying anything at all, that is what you say. If your child is able to say one word, you must say that, because the interpretation, the way we classify that child will change. So this child already now is at least a 1 year old level of speech, because the child has at least three single words. So as against a child who is saying nothing at all, who is pre-verbal, who is below 1 year. So it's very important to always have, I know you want the child to say more, but the fact that the child is at least not completely non-verbal, that is a good start. So we know we just need to build up on the language, not like the child cannot even talk at all. Okay. All right. Okay, Anu was saying there was a way my baby was sounding, so our pediatrician told us to do post nasal space. Okay. The report said there's narrowing. Okay. So your child has adenoids. Okay. Yeah. So you just go back to the same pediatrician. So I don't know. So whenever you've seen a doctor, you've seen a pediatrician, the same pediatrician had to do certain tests, and you've done the test. So the right person to go back to is that same doctor who asks for those tests. There's a reason why she asks for them, and she's asked for them. You've gotten the test now. So the right thing to do is to go back to that same pediatrician and hand it over to the same pediatrician, and she can now interpret it to you, and then she can tell you what is the next thing to do. So what I can deduce from what you wrote here is that this child has adenoids. And how old is that your baby? Is that the 7 month old baby? Yeah, 7 month old baby. That's pretty young. Usually most children don't have issues with adenoids at this age, but it can happen. There's no never in medicine. So your baby has what we call adenoid hypertrophy, and it can cause, that's why babies snore and sometimes they breathe through the mouth, and I have a feeling that is those sounds that you were talking about. So your pediatrician most likely will refer you to the ENT doctors. It depends on how bad it is. If it is not really bad, we will just watch and wait and see, because as children get older, it will get bigger. And then after a while, it will start to shrink, it will get smaller. So sometimes by the time children are 4, 6, it would have shrink on its own, and we will just leave it alone. But sometimes it can be so big and it's causing what we call obstruction of the airway. So obstruction of the airway, so baby can stop to breathe. We call it obstructive sleep apnea. So baby will start to breathe. They will be snoring so loudly, and all of a sudden they will stop breathing, and then after a while they will pick up again and start to breathe. So we call that obstructive sleep apnea. So if your baby is having the complication, baby is having obstructive sleep apnea, or baby is having recurrent infection, so the baby is having infection, fever, which make the snoring worse and all that, at least 6 times in a year. Your baby is not yet up to a year, so it's a little bit tricky. But if the baby is having recurrent infection, you are in and out of hospital, needing antibiotics up to 6 times in a year, then the ENT doctors will likely want to do an operation and go and remove the enlarged adenoid. So they can do what we call adenoidectomy, or they can even do the adenoid and the tonsils, adenotonsillar, the adenotonsillectomy. So they remove both of them if it is causing problem. But if it is not causing problem and it's just big, but the child is otherwise well and the child is not having infections and all that, so we will leave that child alone. We will not do anything about it. But if the child is really having a lot of complication, obstructive sleep apnea, recurrent infections, we will want to schedule the child for a surgery to remove it. The adenoids are part of what we call the lymphatic tissue. They are part of those parts of the body, organs that produce antibodies that help us fight infection. So they are quite important, but sometimes they are too big and causing more problems. So we can remove them, and the other lymphatic tissue in the body will take care of their job. But if not, if the child can do without us taking it out, we try not to take them out, because we know it's going to shrink on its own by 4 to 6. But if it's really causing problem now, then we'll have to take them out. Okay. All right. I know you say your baby is like type 3. So your baby is type 3. That is a little bit like constipation. And so in that case, give your baby a lot of water to drink, a lot of fruits, a lot of vegetables, not just the pap and the milk. Do a lot of that so that the baby can move the bowel. If there's no improvement, see your pediatrician, and we can give the baby some stool softener. We can give the baby some medications to make the stool easier for the baby to pass. But most of the time, babies start having constipation because we are not giving them enough water. We're not giving them fruits and veggies. It's only just the solids, and babies sometimes don't like to drink water spontaneously. So you have to deliberately make conscious efforts to make sure that that child drinks at least half a liter of water, because your baby is 7 months, so you should be drinking at least nothing less than about 500 ml. So you should have a lot of water. I'm talking of liquid generally, including the part, all those ones that still part of the liquid, that should be up to 500 in a day. But also give fruits, give veggies, breastfeed. Don't stop breastfeeding. Breastfeeding also help, and that will help the child's bowel to move. And we want the stool to be type 4, not type 3, and all that. But if you still struggling, your pediatrician can give you something to for help out with the ones that are there already. But you also need to start doing the right thing so that the child doesn't now have more constipation. So I hope that's helpful. Ifoma, how are you? Been a while. I have you on ATP Live. Nice to have you again. All right. So you say your 1-year-old daughter had this small black stain at the back of the two front teeth, at the back of the incisors. Okay. And the tip of both teeth fell a little lighter than the upper teeth. So those are, I'm not happy with those colors. I'm not happy with the colors black. I'm not happy with any change, graduation in color. Yes, so I agree with you. You need to see the dentist. You don't necessarily have to see a pediatric dentist, just need to see any of the dentists first. Because we want the babies, even whether your child has any issues or not, the dentist wants to see your baby from the age of 1 year. They want to see our children every 6 months. So the dentists have their own regular checkup, even if everything is fine. So, but now there is even some issues. I don't know what stain the teeth, or whether it's a form of what we call teeth decay or anything like that. Caries, that's what the dentists call it in their jargons. But it's always good to see the dentist for a regular check so they can have a proper look at it, whether it's something they can clean off, whether it's something they may have to tell you how to do a proper, oral hygiene and all that. But it's better they see the child as soon as possible. Yeah, so definitely see the dentist. All right. Abisola Jejelola. Okay, good evening. I said, when should the baby start rolling? Over the tummy, it's 5 months. Most babies start rolling by 5 to 6 months. So crawling is about 9 months for babies that will crawl. Some babies don't crawl at all, and it is perfectly normal. Some babies will not crawl, they just go from sitting to standing. Some babies will do what we call bottom shuffle. They move with their bum instead of, on their hands and their feet. Instead of crawling on their arms and legs, they just move around with their bottom. So crawling is never a deal breaker for us as pediatricians, and some babies will never crawl. And then standing is about 11 to 12 months, so averagely. So when I give you those kind of figures, I'm giving you the average for 50% of children, 50% of babies. Some babies will do it a little bit earlier, some babies will do it a little bit later. So there's always a range. So when we give a figure, one figure is just to give you the range where 50% average children will do it. It's always what we call a Gaussian curve. If you all remember your maths, I know you don't worry so much about maths and graphs anymore now, but so there is a wide range of what is normal. So some people will be towards the one extreme, some people will be towards the other extreme. But when we talk about when we say the average, we're talking about majority that are in the middle, and usually that is the figures I'm giving you. So rolling will be 5 to 6 months, crawling 9 months, and standing 11 to 12 months. Most babies walk by their first birthday as well by 12 months. But we will not worry. But we also have what we call the cutoff age. So for me, I will only start to worry if your child is not walking by 18 months. So average child works at 12 months, but whether your baby walk at 13 months, 14 months, I'm still not worried. The only time I will start worried if your baby is not walking by 18 months, then that is when it will become an health issue. All right. Oh, there's Major Evans on Instagram. Oh, longest time. How are you? So Major Evans and Informa, they are the regulars on ATP Live. So I'm glad to have both of them today. Welcome, welcome. All right, say fever of 38 after discharge normal. Fever is never normal, so we don't want a child to have fever. So some things are never normal. So a child having fever of 38 is never normal. So the issue is, do we know why the child is having the fever, and are we dealing with the cause of the fever? But the fever itself is never normal. Okay. Before the child was discharged, there was no fever. She was on quinine. Okay. So I'm assuming that you are going home with the quinine. So are you still on treatment? So if you are still on treatment, sometimes we discharge children if they are getting better. It doesn't mean that they are completely well, but we can't always keep you in the hospital for the whole treatment duration. Number one is children recover better at home. And also, of course, the cost implication of keeping you on the bed. And maybe there are other children that may also need that bed. So sometimes when a child is already on the mending trend, the child is already getting better. So we only expect the child to get better and better. We will discharge them. But it doesn't mean that they are perfectly well. But we just know that they are going home and we will continue the treatment at home. So if you are still on treatment for quinine, which is what I'm assuming, then just give the child the medication. You can give the paracetamol that you were given in the hospital. So the child was sick, so the child was already being treated. So just continue with the treatment. I won't worry so much about it if the child is already on treatment, so you can just watch. But if the fever persists or the child is now even getting worse or anything, of course, you can always go back to the doctors at the hospital. We are happy to see you again. But if the child is getting better, the child looks well, the child is eating, the child is doing well, just keep giving the medication. Fever of 38 is not enough to rush back to the hospital. You can just keep giving the medication. If it's going to 39, 40, I will be worried, and then you may want to come back. But if it's just 38, that's what we call low grade fever, but it's still a fever. Just give the child's medication, keep an eye, and then just monitor for now. So since the child is still on treatment, I will not worry so much about it. Okay, I know. Okay, say, oh yes, we did that, was referred to ENT doctors. Okay, seems like everybody is asking me questions they already have answers to. Okay, but it's okay. I know sometimes some of us ask this question, you just want to double check whether your doctors are doing the right thing or not. Okay. Abisola Jejelola, I didn't omit your questions. I think I've answered your question now. Yes, I've answered your question. You were just I moved from Facebook to Instagram, so maybe you thought I didn't omit it, but I always try to go from Facebook to Instagram, so don't worry about it. Okay. But I believe I've answered your question now, so I'll come back. But if you have more questions, please go ahead and ask. I know say they gave us nasal drop, yeah, antibiotics, I guess. Yeah, so no problem. So just keep doing what your doctor said. So like I said, most of the time we just try to watch. We try, if the child has an infection, we'll treat the infection and we just watch. But if the infection becomes more recurrent, we are always treating infection. That is when we may want to consider surgery. But like I said, your baby is not even up to a year yet. So we're talking of 6 episodes of infection within 1 year. So which your baby doesn't even qualify because your baby is not yet even up to a year. But 7 months is actually pretty early for a child to start having adenoids. And so I won't be surprised if your child may need surgery in the long run because the child is starting pretty early. But children, each child is different, and the way they progress may also be different. So no need to worry about that. But at least I'm happy you've seen the ENT doctors. That's good. That's appropriate. Okay, Carl Sarah Bisola is asking for a friend. Promise to ask. Okay, what are the things to look out to know if a child has autism? All right, thank you. That's a lovely question. Autism is quite actually April last month is our Autism Awareness Week. months. Actually, the April 2nd is Autism Awareness Day, but the whole of April is Autism Awareness Month, and we talked a lot about autism. But I will just recap again. So usually, basically, what happens in autism, that it's a neurodevelopmental condition where children have some differences. Okay, I'm choosing my words very carefully. Some differences in what we call social interaction, the way they relate with people, other children around them, and they may also have what we call some repetitive and restrictive behavior. So those are the two big things that happen in autism. So children on autism, depending on the age of the child, there are some what we call early red flags. So number one, the children may be have speech delay, they don't talk on time, they may have different difficulty with looking at people, high contact, they may want to be on their own, they don't want to play with other children. Most time by children by the age of 18 months or thereabout, they want to play with other children. But children with autism, they like to be on their own. They don't want to interact. They may not have eye contact. They tend to have facial expression, like when you smile at a child, they should smile back at you. Children on the autism spectrum may not do all that. Sometimes they also have all sort of repetitive behavior, like they may be banging their head repetitively, or they may be spinning around. Sometimes they are talking, they may just be repeating the same thing, repeating words after people or after what program they watch. They also may have a lot of what we call sensory differences. So they may not like loud noises. They will cover their hair to loud noises. They may not like you to have their hair washed or haircuts. So they may not like food. They are very fussy with food because of the texture of the food. And so many things. They may not do, when children don't talk, for children who don't have speech, they compensate with what we call non-verbal communication. So they will point, they will do other means to get you to know what they want to say. But children with autism also have deficits with their non-verbal communication. So they may not point, they may not, so they won't point to share things. If they hurt themselves, they may not come to you for you to hug them or comfort them. Some of them don't want you to hug them even when you try to come near them and all that. So there are so many, depending on the level of the child. So autism, there are lots of red flags that you can look out for. There are lots of videos online on social media that you can see about autism red flag. They will play those videos for you to see. They may line up things. They will do the same thing over and over and over again, line up toys and all that. So from age of 16 months, we have the MCHAT, modified checklist for autism in toddlers. You can use it to screen your child. So if you worry, so just that when people are answering questions, sometimes it is not an exam. This kind of screening question is not an exam. We just want to know what the child is able to do or not able to do, and that will give us an idea whether should we worry about autism. It's just a screening. It doesn't give a diagnosis. It just tell you whether it's a child that needs to see a pediatrician or not. So some mothers pick up autism as early as even when babies are born. I mean, like some mothers will know that this child is just always so quiet, doesn't cry for anything, he's not bothered by anything. They sometimes look like that's a good baby, but it actually could be that the child doesn't send any of you, and that could also be a red flag for autism. So some others, I have seen mothers come to me like they've always known there's something wrong, even from the first month or second month. But majority of parents pick up autism features by the time the children are about 1 to 2 years, when they begin to do all those repetitive behavior, when they begin to have the speech delay, when they are not doing the pointing, when they are not responding to their name, when they're not giving the eye contact. So the Academy of the American Academy of Pediatrics recommends that we screen all children for autism, and we tend to use tools like the MCHAT, the modified checklist for autism in toddlers. So it's just a simple yes or no, and we throw in a few other questions to confuse parents as well, but so that people will not just answer oh yes, or no, that kind of a thing. So if you do that screening, and it's something you can do online, it will automatically give you back a feedback. But remember, it's what you put inside it that will come back to you. So sometimes parents will think, oh, they just want to be nice with their child, so they will not be completely honest about it. So then the screening will come back as saying there's nothing wrong. I've seen mothers who screen their child at 0, like me, there's no features of autism at all, but you can see the child is having the features. So it depends. So I always say, it's a screening tool. It is what you put in that you get out of it. So be honest, just say it the way it is. And so if the screening come back showing high score, it means there are flags of autism. I think the NHS also now have what we call the autism quotient as well, AQ10, and they have the child version of it. Again, just that one is just about 10 questions. So depending on the score, if the child had a score of 6 out of 10, again, we will worry about autism in that child. So there are lots of screening tools online. So just use one of them. And if the child has a high score on it, then that means you need to see a pediatrician who can do an autism assessment. Not every pediatrician can do autism. Usually neurodevelopmental pediatricians, child psychiatrists, those are the people that should be able to do those kind of autism assessment. All right. So I hope that's helpful. But I've written a lovely article. I have podcasts on autism because that is my field. I do a lot of autism assessment. So if you want to learn more about autism, you can go to our website, read about, just put autism in the search box. You will see all the articles on autism, or go to the podcast, Ask Dr. Gbemi ATP podcast. It is available on all the podcast platforms, Spotify, Google, Amazon Music, Google Podcasts. You can search for my podcast and look for the autism one and listen to it. And you can also read about it on our website as well. So also on our YouTube channel. So there are lots of autism resources that we've put out there. Yeah, a 7-month-old should start responding to their name. Where usually from 7-month-old, they will turn. When you call their name, they turn. That is just the response. So you call their name, they begin to turn to their name. So if your child is not responding to their name, it could be a red flag for autism. Yeah. So some of these things could be normal behavior for some children. There's no one particular thing that a child would do that will make the child autistic. That's one thing you need to understand about autism. There is nothing you have said. All these things you said could just happen also in a child. For example, a child who decides to ignore you will not respond to their name, not because they don't hear or they have autism, they just don't want to answer. So, which is why we said these are screening tools. But the more of them you have, the more we get worried about that child. But then that child still needs to come to us and do a full assessment. So we will now look into every criteria to see whether the child is also having features. So if it's only one thing that the child is doing, but the child is doing everything else okay, we're not going to say the child has autism. So just for you to be mindful of that. There is no one thing. Some people say, my child doesn't give, but my child give eye contact. And also the contrary, the converse is also true. In other words, the fact that your child is able to do all these things does also not mean the child cannot have autism. Because a lot of parents will say, oh, my child can give eye contact. Oh, my child can smile at you. That child can still have autism as well. So there are so many things to look out for. So it's not just the fact that the child give eye contact automatically rule out autism. No, the fact that the child does not give eye contact does not also automatically mean the child has autism. I know it's a little bit confusing for parents, but just for you to know that it's a spectrum thing, it's a clinical diagnosis, it's not something we do on blood tests, so we have to do a proper autism assessment. Don't self-diagnose your child, okay? Just let the child come to the right specialist first. All right, I hope that's helpful, Gbemisola. All right, I think I've answered all the questions that I have, but if you still have any questions, feel free to go to our Facebook group. We are there Mondays to Saturdays. Post your questions and we will try and answer them, okay? If you've put your question on our Facebook, just be patient with us. Some of us also don't follow our guidelines. Please read the guidelines for posting our group. For example, you can't post naked photos. There's no need to post 2-3 photos of the same thing. We only allow one photo or one video per post. So just make sure you read our guideline first before you post, so that you won't post and we decline your post. And there are some things that Facebook doesn't like, and so we won't allow that as well, so that we don't get our group taken off Facebook as well. So there are lots of other things that we all have to be careful about. So I think that is all. So thank you so much, everyone. You can watch the repeat if you are just coming online. Thank you for coming, but you can rewatch the video, and if you still have any question, please go to our Facebook group and post your questions there. I will see you again same time next week, God willing. Before then, have a wonderful, wonderful time, and keep following ATP on all our social media. Thank you. Bye bye.